Have you ever been affected by stress, anxiety, or depression? If so, how do you normally cope with the symptoms of these mental health issues? Do you turn to home remedies that were taught to you by your parents, or do you turn to medical professionals for help? Well, whatever you turn to, what if I told you that you're actually being influenced by your ancestors and that your decisions are actually a byproduct of cultural evolution? Hi, my name is Sam Carr, and today I'll be explaining how stress and mental health affect Native Americans and Americans differently due to the process of selection. Stress and mental health are topics that are commonly talked about in American society today. However, different cultures have a different way of dealing with mental health issues, and this difference can be explained through the process of cultural evolution. According to Kleesner and Turek, cultural evolution is a cultural change explained as a Darwinian evolutionary process. And according to Masudi, culture can be described as a socially transmitted information such as beliefs, knowledge, skills, or practices. And if you take a look here over at the image on the screen, you can see that human genes along with human culture are passed on to the offspring very similarly. Human genes are passed from parent to offspring, and human culture are passed the same way from parent to offspring, but they can also be passed through kin, non-kin, societal norms, and peers as well. Cultural evolution can be broken up into 4 mechanisms, including natural selection, mutation, migration, and genetic drift. For this presentation, I'll be focusing on natural selection and how it can lead to differences seen between cultures. According to the Berkeley University of California, there are currently 4 tenets of evolution by natural selection. The first one being there is variation between traits. Second, there is differential reproduction. Third, there is heredity. And 4, the end result of producing more and more offspring. The Berkeley University of California goes on to use an example of beetles to explain natural selection. With the beetle example, variation can be seen in the first image between beetles and their colors. As you can see, some beetles are green and some beetles are brown. In the next image, differential reproduction is occurring as the green beetles are picked off by a predator and the brown ones are the only ones left to reproduce. In the next 2 pictures, we can see that the beetles that survived, in this case the brown beetles, will pass on this trait to their offspring, which will be passed on for more and more generations to come. In agreement with the Berkeley University of California, in an article titled Natural Selection, the National Geographic Society states that individuals in a population are naturally variable, meaning that they are different in some ways. This variation means that some individuals have traits better suited for the environment than others. So if we look back at the beetle example, again, we can see that the brown beetles were more suited for the environment compared to the green beetles. Just as natural selection can be used to explain how genes and traits change over time, natural selection can also be used in cultural evolution to explain how cultures differ. It all states that the Darwinian approach can be applied to any self-replicating code, including culture. And in this case, culture is a system of rules that guides, not determines, human action. In other words, beliefs and values can be passed on to future generations through the process of natural selection by cultural evolution. Overall, culture, just like genes and traits, can be passed on to future generations or modified if needed to match generational standards. As you can see from this table, cultural evolution is when behavior or cultural characteristics are passed onto members of a family or social group between generations, and genetic evolution is passed on through hereditary information throughout generations. 2 cultures that have distinct cultural differences are Native Americans and Americans. Since both these populations live so close in vicinity to one another, you may assume that these cultures would rub off on each other, but that does not seem to be the case. One example of differences that can be seen between the 2 cultures is how they deal with and cope with mental health issues such as stress in their societies. According to Vegetin, 1 in 5 American adults experience mental illness at a certain point in their lives. And Americans have even taken strides to raise awareness for mental health issues by naming May Mental Health Awareness Month. However, Native Americans view mental health in a very different way. According to Nebel Folk, Native Americans have experienced genocide, forced assimilation, involuntary relocation, and displacement. And as you can see, this could have caused Native Americans and have caused them a lot of trauma. However, Native Americans try to identify and maintain traditional beliefs and values while they participate in the contemporary world. So they do not follow many of the same coping techniques that Americans do today, and these differences can be explained through the process of natural selection. According to Santori, Native Americans make up 2% of the U.S. population, with 21% of Native Americans lacking healthcare coverage compared to 9.4% of Americans. With this in mind, Native Americans are known to have a high prevalence of mental health issues that are not treated by medical professionals due to the lack of accommodation for Native Americans, and due to the fact that most American medicine does not take into account the Native Americans' religious beliefs. According to Reynolds, between the years 1880 and 1930, Americans tried to change the values and beliefs of Native Americans with assimilation and allotment. The goal of this was for the American government to assimilate American Indians into the mainstream of American life by changing their customs, values, beliefs, dress, occupations, languages, religions, and philosophies. This caused many Native Americans to distrust Americans and their policies, along with American medicine. This, along with past assimilation and displacement, also led to intergenerational trauma within the Native American community. According to Santori, Native Americans continue to face intergenerational trauma, which is defined as collective, cumulative, emotional wounding across generations resulting from events affecting whole communities. And when looking at cultural evolution through the view of natural selection, we see that this trauma is passed on from generation to generation. This trauma was caused by loss of land, forced relocation, separation of families when children were sent to boarding schools, and loss of culture, and was once again passed on through generations in the way of storytelling. From all this trauma, Native Americans have turned towards religious and sacred practices on how to deal with stress and mental illnesses. One way how Natives deal with stress is through silence. Silence is a really big part of Native American culture, and according to Brown and Cousins, Native Americans recognize that in silence there are profound modes of sacred, humanizing communication. So during times of stress, Native Americans tend to fall back on their religious beliefs, such as silence, that were passed on to them by their parents and grandparents. And according to Brown and Cousins, elders are fully linked to the life of the tribe through their role as transmitters. They have the very significant task of passing on knowledge to young people. So overall, many of these beliefs on how to deal with stress are passed on through Native American ancestors, so Natives do not rely on the American style of healing, which is through the process of medicine. Many of this knowledge that is passed from elders to the younger generation are religious customs on how to deal with stress, such as different ceremonies and traditional customs for healing, as Reynolds et al. Mentions that when dealing with mental illness, Native Americans tend to reestablish traditional customs, ceremonies, values, and beliefs for the purpose of healing and wellness. Reynolds et al. Also brings up the point on how incorporating Natives' religious beliefs into mental health prescriptions or therapies may cause Natives to feel more welcomed in American healthcare. As Reynolds states, Native values and beliefs are essential to the wellness of these groups and should be incorporated into the healthcare system. Overall, all those customs and beliefs are passed on to future generations through selection in the process of cultural evolution, and is why Native American culture is so much different than American culture is today. When we talk about American culture, over the years, Americans have been trying to reduce the negative stigma surrounding mental health. Many Americans seek a medical professional's help when it comes to mental health rather than falling back on religious beliefs such as what the Native Americans do. And according to Saha et al., 1 in 6 Americans take psychiatric medications to help with mood, psychotic, and anxiety disorders. And according to Gloria and Steinhardt, they mention how most adult Americans who deal with chronic exposure to high levels of stress, which cause them to rely on medicine and therapy for help. And when we talk about therapy, Americans normally go to therapy to learn cognitive behavioral coping strategies to focus on identifying and changing the maladaptive thinking and behavior that create stress. So instead of relying on religion, most Americans tend to rely on medicine. As you have seen, Americans tend to rely on medicine and therapy when dealing with mental health issues. But how does natural selection actually play into this? The answer to this question is that children in America are pushed at a very young age to be the best they can be and to dream big. And for many children, this means that they want to become lawyers, police officers, veterinarians, firefighters, and most importantly, doctors. This idea of becoming a doctor is most likely given to children through parents and grandparents, especially if the child's family is in the medical field. And I can actually relate to this because at a young age, both my parents and my grandparents pushed me and my cousins to become doctors and join the medical field. And as we are now entering college and some of my cousins are finishing college, we are all taking careers and field paths that push us into the medical field. And according to Parmley, most doctors want their children to follow in their footsteps as it is a working environment that is far superior to that of many other professions. These children are being fed ideas of working in the medical field over many generations, much like the Native Americans were fed ideas of their religious beliefs through generations. If becoming a doctor runs in a family, the children are more likely to turn to doctors when they are in need of assistance, such as needing help for mental illnesses. When looking at both cultures, we can see how cultural evolution comes into play with the mechanism of natural selection. Natural selection is actually a good way of explaining the reasoning behind these cultural differences. When talking about cultural evolution, I mentioned earlier how there are 4 mechanisms of cultural evolution, and of those 4, some researchers may argue that migration is taking place, and that is why there's cultural differences seen between cultures. However, as you have seen from this presentation, that is not the case. For migration to occur, Europeans traveling to America would have had to develop more Native American beliefs, or the Native Americans would have had to develop more European beliefs. However, this was not the case, meaning that the only logical mechanism that could have been in play is selection. Through natural selection, the cultural beliefs and values are passed down from generation to generation, and each population separately. No cultural values were being changed by the other. The ability of both these cultures to maintain their beliefs while living in close proximity to one another ties into the mechanism of natural selection. Overall, this goes to show how cultural evolution can be used as a way to explain differences seen between cultures and gives people a better understanding of how different populations of individuals are so different. And I hope from this presentation that you take away the relevance of cultural evolution and ask yourselves this question: how can you see cultural evolution in your own cultural values and beliefs today? Here is my references, and thank you very much for listening to my presentation.